Good day, everyone. And I want to welcome all the members of the steering committee. Thank you for taking your time to join us today. We are excited to present our proposal for the YMCA Winnipeg Community Wellness Center Expansion Project. My name is Tolulope Bewaji, and I'm going to be leading this project as the project manager. I've been doing this for over 15 years with YMCA. Joining me on this journey are Erica, our operations and facility lead, and Ibirunke, our community engagement lead. Over to you, Erica. Thank you.
Thank you, Tolu. Hi, everyone. My name is Erica Alfonso. In that project, I am the sponsor and the leader, and I have 10 years experience in the project management in my home country. I call Ibirank.
Okay, thank you, Erica. Hi, everyone. My name is Ibirunke Kwewumi. I've been working with YMCA for the past 12 years as the community engagement lead. Thank you. I would like to call on Tolu.
In this project, we have our aspiration, and I would like to talk about that first. Our aspiration with this project is to create a vibrant, inclusive space where all Winnipeggers can access physical fitness, mental health support, and social services in one integrated wellness hub. This initiative is a direct response to the rising demand in undeserved areas, and it aligns strongly with YMCA Winnipeg's mission to build healthy communities. When we talk about the project background, we discovered there is a need for us to do an assessment, and this assessment was conducted in late 2024. And the assessment revealed a huge gap in community wellness services in the Northeast Winnipeg. Existing YMCA locations are over capacity already, and this project aims to address those needs by establishing a new 10,000 square meter facility with programs focused on youth, seniors, and families. Then in this project, our vision is to create a welcoming space where every individual have access to wellness, to connection, and personal growth. We have 5 key objectives that we are going to be observing while on this project. One is designing and launching the facility by April 26, which is the timeline. Number 2 is serving at least 1,000 community members in the first year of completing the project. Then the third one is hiring and training 15 full-time staff and 20 volunteers. Then the next one is integrating fitness, mental health, and social programs into the existing programs that we have in YMCA presently. While the last one is to partner with local schools and clinics for support and referrals. Then the timeline, we are broken into 5 phases. Planning from May to July 2025, which is going to be the first phase. The second phase is design and permitting in late summer, while the construction will take place through the winter. That's the third phase. While the fourth phase will be staff onboarding, and the full launch, which is the last phase, will be in April 2026. I would like to call on Erica to walk us through the budget and the team structure. Thank you.
Thank you, Tolu.
Erica. You're welcome.
Thank you, Tolu. So in that moment, I explained about the total budget. In that moment, for the total budget in that project is $1,830,000. For each item is permits and planning, construction, equipment, staffing and training, marketing, and contingency. We explain about the timeline. The timeline is composed for 12 months. 5 phases and 2 project plan update. So the first month is strategic planning. The second is detailed analysis. 30 is the architectural design. Number 4 is initial preparing and grounding. Number 5 is construction of the main structure. The number 6 is initial finishes. Number 7 is decoration and external details. Number 8 is main equipment. Number 9 is test and certification. Number 10 and 11 is final preparation. And the number 11 is inauguration. Okay, the timeline is for the 5 phases. The first is planning and site feasibility is between the May to July 2025. The phase number 2 is design and permitting is between the month August to October 2025. Phase number 3 is construction and fit out is between the month November 2025 to January 2026. The number 4 is staff hiring and program development is between the February to March 2026. And final, the phase number 5 soft launch and community orientation is final in the April 2026. So the project team members, I a project sponsor and the president in my position. Tolio Lupe is a project management. Ibu Rank is the project champion in the project role and the position the hiring manager. We have 2 steering community members for the financial manager and the legal manager. And we have a 5 team member design in the position engineer manager, health and safety manager, marketing manager, architect manager, and procurement manager. This is the project organizational chart. We have first the president, then the project management with the project steering community and the project champion, and the explain for the procurement manager, hiring manager, financial, legal, engineer, health and safety manager, and marketing manager with architect manager. And this compose about the all activities and the people, we need people about that. Okay, in that moment, I explain about the high level assumption. We have 4 assumption for that project. The first is the project starting the spring season. And if detailed planning with define the phrases if followed, then construction of the wellness center will be complete between the estimated 18 months with no significant deviation and the schedule due the weather condition. The second is by integrity or requirements established by Manitoba provincial building codes and environment regulation from the design the phases. The number 3, if the budget is properly managed with the cost control system and reserves are provided for possible deviation, then the project can be executed within budgets without the compromising quality or scope. And final, involve the local community and key stakeholder from the early stage for the project through public consultation and transparent communication with the result the great social. In that case, I call my partner Ibi Ran, who will talk about the community engagement.
Thank you, Erica. To guide a successful adoption, we are applying the ADKAR model, which the first one is awareness. We are going to use flyers, town hall, and online updates. For desire, we are going to involve the community participation in naming rooms and shaping the program. So for knowledge, we are going to involve we are going to train we are going to use our training materials for staff. And for ability, we are going to make use of stimulations and dry runs. So for reinforcement, we are going to make use of monthly check-in and community feedback loop. So we are going to know that effective communication is the key. As we move forward in this project, we shall ensure the following. First, the YEMCA executive will receive bi-weekly updates. Construction partners will meet weekly on site. Also, community members will be reached through social media platform, and staff will receive a weekly update via Slack and in-person briefly. Secondly, we are going to use a blend of Zoom, Slack, newspapers, social media platform, and we are also setting up a project dashboard with Gantt chart and KPIs for the initial tracking. So lastly, the key stakeholder matrix, we are going to use the YMCK CA executives, which they have the high influence and high interest. For the community, for the city permit office, we are going to use, they have a medium interest and high influence. And for local residents and volunteers, which they have high interest and medium influence. Also, the last one, which are the donors, they have high influence, and there are people who require transparent communication. Each group has a tailored engagement plan. So I would like to call on Tolu to wrap up.
Okay, thank you, Ibirunke, our able community engagement lead. We appreciate that report on how we are going to be communicating with all stakeholders and the steering committee members. And in wrapping up this meeting, I would like to talk about the risk and our mitigation strategy and next step. So we are in any project, there's always an imminent risk that you don't plan for, and they just come up. So we are aware of those potential risks, which are not limited to delays in getting permits for the construction, volunteer recruitment challenges, or funding shortfalls. We have already built buffers and mitigation strategies, such as early applications and phase programming, if needed or if required. Then after that, the next step is for us to submit the final permit request by May, then host a public information section in June, issue construction RFPs by July, then begin hiring by February 2026. And lastly, we aim for a complete community launch in April 2026. This concludes our presentation for today. On behalf of my team, Erica and Ibirunke with myself, I want to thank everyone for their time and support. We welcome your feedback and look forward to working together to bring this vision to life. Thank you, team. Thank you, everyone.
Thank you.
Thank you, Ran.
Yeah.
Thank you.